Hi, it's Dr. Greg Jantz. Insomnia and anxiety? Hi. I used to work in a sleep research laboratory. I'm going to tell you more about this connection and what to do about it next here on Hope and Possibility.
Dr. Gregory Jantz is a best-selling author of over 45 books and the founder of the Center A Place of Hope, voted a top 10 center for depression treatment in the U.S. As the pioneer of whole person care, Dr. Jantz is known as the messenger of hope. Now the nation's expert on anxiety, depression, substance abuse, relationships, trauma, and PTSD, here is Dr. Gregory Jantz.
Okay, as a counselor and mental health professional, I've, over the years, it's been 40 plus years, I've authored at this point 45 books. I say 45 because I'm working on the next two books right now. And one of those happens to be issues of sleep and mental health. And I did work in a sleep research lab many years ago, and I was an assistant to a researcher and researchers who were studying various aspects of sleep. And I've always been interested in sleep and what happens to our mental health. And that's why here at the Center, A Place of Hope, we actually do sleep studies on individuals who are coming as clients. It's kind of interesting. We say the word sleep studies. A study. It's really a sleep test, and it's a test to see what are the stages of sleep. Am I going through 1, 2, 3, 4? Number 5, REM, rapid eye movement. How much time am I spending in these stages? How long does it take me to enter the stages of sleep, etc.? We know that, for example, alcohol, other drugs or medications does, in fact, cause us to have our sleep stages altered. There's times like alcohol. You drink alcohol, you may not feel great the next morning. You don't feel rested because it's affected sleep stages. So let's talk about insomnia, the inability to fall asleep and at times stay asleep. And sometimes, and the most common that we see in mental health wise is a person says, you know what, I just can't stop my mind. I can't stop it. And my mind is racing. I can't calm down to fall asleep. I mean, that's very common. And you feel anxious. Anxiety is like probably the number one issue that will keep you awake. I'm anxious. And then my brain doesn't seem to go into a sleep state, and my mind is ruminating over and over. If I'm depressed, I go, I can hardly wait to get to sleep. I'm just going to go to sleep. But anxiety is different. Anxiety and insomnia, think of it this way, they feed off of each other. It can create a cycle that feels impossible to break. But let's look at this. Let's break it down. Insomnia and anxiety go hand in hand. You may have had anxiety first, and you couldn't sleep, or you're struggling with sleep and now you feel anxious. So it goes both ways. Anxiety-driven insomnia, I put here in my notes, is a vicious cycle. The lack of sleep makes the anxiety worse, and then we just can't cope with the stressors that are before us. And so that is an area that we must look at. As you look at the connection, we understand, okay, I do need to deal with the anxiety. Right over my shoulder is a book I just noticed that I wrote called The Anxiety Reset. And because with a workbook, because we have to reset what anxiety is doing to our mind, our physiology, our digestion. And there's a resetting physically. There's a resetting, I'm going to say, faith-wise. What do I believe? And there's a resetting mentally. How do I control my thinking? Let's look at the number one issue. That's constant worrying. Your mind, I wrote here, your mind's overwhelmed with anxious thoughts and you want to unwind and go to sleep, but you can't. It's choking me up. It's that constant rumination. It's the what ifs. What if? What if I lose my job? What if they reject me? What if my spouse is cheating on me? It can be random. Look for random and extreme, my thoughts, over and over and over. So That's a big one. Remember, worry initially is a mental process. I worry enough, I can kick it into anxiety, then I have physical symptoms, and I'm not doing well. That's when it kicks it into anxiety. All right. Elevated, here's the next one we need to look at. This is just the impact of anxiety in our sleep. So the constant worrying. Constant worrying can train your body to be anxious. Absolutely. Or you feel anxious, you can't sleep, and then you worry. You see how all this has an inner dance. And it's the whole question, well, what came first? It may not matter what came first, because we're always going to need to go back, treat anxiety, and eventually the mind and the body will follow. All right. So elevated stress hormones. Anxiety triggers over time the release of the hormone cortisol. Lots available online on this cortisol. And this is, we sometimes think of it, the stress hormone. It can be right there for you and in a heightened state, that fight or run, flight, or too much cortisol that's because of chronic stress. I'm stressed out, is going to prevent restful sleep. So I got to go back. What's my stressors? What's my chronic stress? What's my body saying to me? Do I have headaches? Do I have aches and pains? Is my digestion off? Can I concentrate or not concentrate? You're going to notice a lot of physical symptoms. All right. So remember, even if I have, let's say, testosterone, estrogen, hormones that are off in my body, melatonin's a hormone. Sometimes people think if I have insomnia, I need to take a bunch of melatonin. I'm going to say do that with the proper guidance, because we want to create a good plan. Taking melatonin may not take care of anxiety, for example, and then I'm going to have disappointment. All right, so hormonal issues. Have my blood work done. Look at where's my hormonal issues. What's going on there? Do I have low vitamin D? Do I have vitamin D levels that are affecting my immunity, affecting my sleep? Is my hormonal levels off? Do I have thyroid issues? Have the blood work done. All right, number three, physical discomfort. Anxiety does create a lot of muscle tension. Notice your breathing, shallow breathing. Sometimes with anxiety, before you go to bed, you'll notice I'm breathing really fast and I'm not doing the deep breaths, and that's going to perpetuate difficulty following asleep. So the simple is learning some of the quick breathing techniques. 3 deep breaths in, and just starting. And then maybe I'm going to meditate or say a Bible promise, an affirmation, but I'm going to renew my mind at the same time I'm breathing, for example. All right, nighttime panic. Because we work a lot with people with anxiety and panic disorders, a lot of people with anxiety are going to experience panic attacks, and just those heightened feelings of dread. And it comes at night. Why is it? It's 2 or 3 in the morning, right? It comes at night, and it can really make sleep feel impossible. You can just lay there and having panic. You can have a panic attack in your sleep. You feel like, man, I was finally fell asleep, and then all of a sudden I'm wide awake. I'm in a cold sweat, and I'm gasping for air, and I'm having a panic attack in my sleep that woke me up. That can happen as well. So this is all kind of perfect storm for insomnia. After a while, it's like I'm afraid I can't sleep. Then I'm afraid to go to sleep because of the panic. Here's just a couple practical tips. Now, you'll see that I'm a fan of the whole person. This is what we've been doing 40 plus years. That's why I said right off, I want to know what the blood work says. I want to be working with a physician. And that's why we have physicians here at the center, a place of hope, who We can look at the blood work, do the blood work, and our physicians are going to look and see what could be off that's contributing to the anxiety and therefore the insomnia. But always have a calming bed pre-sleep routine. So 1 hour, I like to say 1 hour before bed, you're not on your devices, you're not on a screen. And be careful what, I'm not drinking a lot of liquids an hour before bed because I don't want to get up and have to go to the bathroom. I'm looking in my bedroom. Is it dark? A lot of, if you go to a hotel room and there's the lights on everything out throughout the room, you probably noticed that. You go, that's not a dark room. So if you need to put a pillow over a light and have no screens in your room, no TV in rooms, for example. What we want to do is have a little journal. I want you to write down all the things that seem troublesome to you. Maybe your concerns, write them down in the journal. Put it up there on the nightstand. Be done with it. A dark, really dark. Don't have your device, your phones in there. Put them in the bathroom, the closet. Some people say, well, I use it for my alarm. Put it in another room. No devices in the room. You wouldn't believe how often just doing that can be of such great help. All right, we're going to tackle anxiety throughout the day. So this is just our bedtime routine. Lots of good information out there on this. And in my book, Anxiety Reset, there's some more good ideas. I mentioned that because I can only spend so much time doing this podcast, and I want to resource you with as much as I can. Tackle anxiety during the day is my note. And this is everything from journaling. This is everything from appropriate exercise, walking, 20-minute walks, drinking your water throughout the day. All that is so important. So, I also want to just make a note that each day we can reflect on our worries, and the whole area of journaling or Bible reading, guided workbook, like in the Anxiety Reset, I've got a workbook, things I want you to be working on to deal with the anxiety right off the bat. Okay, what does that look like? I've got to stay engaged in the process of getting help. Sometimes I need more intensive professional help, and I need to learn how to have sleep hygiene. Think of the bedroom as a sanctuary for rest. The blackout curtains, the pillows, the white noise, if you need that, can make a huge difference. Relaxation and breathing techniques, big difference. There's the progressive muscle relaxation. You can start at your toes, you tense and release it, and you work your way up through each muscle group. The physical act of concentrating on my muscles, tense them, relax. Even that point of focus can make a big difference. Let me say, things we put in our mouth do matter. Nutritionally, my diet does matter as it relates back to insomnia. I do look at that. I look at fiber, I look at sugar intake, and I mentioned it before, but what are we doing on water intake? Alcohol gets tossed out the window if it's in the pitcher. Alcohol and sleep do not go together. So if that's something that a person's doing, got to get rid of it. Cannabis. We do not use here at the Center Place of Hope addictive sleep medications. Our doctors don't do that. But it's just amazing what you can do when you get to the core. What's the root causes of the anxiety? What has happened? What's the trauma? And dealing with that and retraining the body. and it can be retrained. And yes, there are some supplements, there are some things you can do that can be of help, but I always want you to work with a good, knowledgeable healthcare provider who can really be a key to that. And what I want us to look at is the teas that can be soothing, the supplements, the melatonin. Work with somebody who specializes in sleep. And there are some great resources of people and professionals that work with sleep that really can help. We tend to see somebody when they've had years and years of insomnia and sleep disorders and anxiety and depression, and we're working with them on a mental health level to help resolve issues so that their body can be retrained to be able to establish sleep. It is, for most people, really, it is the 7 to 8 hours. It's circadian rhythms, it's patterns. And we look at, okay, a person work in a situation where they were a night shift worker. Where did circadian rhythms get off? Where did I have a pattern that created insomnia? Most people can remember one or two significant events that contributed to insomnia and anxiety. So now, restorative rest, 30 plus days as we really start to help somebody with this and they start to experience a different level of restoration. Some people say, man, my sleep is so sweet. That's a funny word to describe it, but they'll describe that. We do IV nutrient therapy for people. We can do some calming amino acids. Our doctors do this. Where they have a formula that's calming for the body, and they do these. Maybe it's once a week. While we have a client here over 4 weeks, and their body begins to make the transition. So the big hope is there is big hope because there is answers. It's usually multi-level answers. So I'm going to look at nutrient deficiencies, blood work, hormonal deficiencies, trauma, things my body may be suffering that are contributing. And then one area I want to mention that gets overlooked sometimes is a medication that I could be taking that is creating an effect that is disruptive to my sleep. And so somebody who specializes, a physician who specializes in the medication, for us, our doctors, our advanced nurse practitioners who are specialists in medication issues begin to look at this and go, okay, here's what's happening. So we just got to sort it all out. Sleep is like a 1,000-piece puzzle. You got to stay with it till you get all the pieces in. And I know from my early work on the Sleep Research Laboratory up to current day-to-day where we do sleep studies on individuals here, I know there is hope and healing for sleep issues, and you can move from a place of lifelong struggling insomnia, and you can move to a place where I feel restored and I wake up in the morning and I feel so different. Okay, so one other area that we need to look at is sleep apnea, where I stop breathing during the night, may not even realize it. There's obstructive sleep apnea, which my tongue may go back and then I'm gasping for air. That's called obstructive. And during the night I wake up, or my spouse elbows me and says, "You're not breathing." Then there's a more internal brain issue, sleep apnea. So this is, again, sleep apnea will affect our mental well-being. So it all goes together. All right. There's hope for insomnia. I am a big fan of alternatives and thinking outside of the box, but I don't believe there's any one magic pill. There may be something that's been overlooked, and when we address it, it feels like, oh wow, and suddenly I'm feeling better, and that's the goal. But there's usually more than one missing piece to the puzzle, to our insomnia and to anxiety. resource and get all you can. That's why I mentioned Anxiety Reset. I'm excited on our new release in the book on insomnia or sleep issues and mental health, because it goes hand in hand, and there is hope. And it is amazing, even sometimes as simple as the appropriate nutrition and nutrients and nutrient deficiencies. When we put all this together, the powerful difference that it can make in a person's life, and there can be restorative sweet sleep.